Good day, everybody. I am Mariam Asadi, and I'm delighted to present a general overview along with some helpful insights of the UBC-OCEAN competition, which focuses on the classification of ovarian cancer subtypes and the detection of outliers. Let's get started. I am from the AIM Lab, AI in Medicine, under the supervision of Dr. Ali Bashoshati, affiliated by both University of British Columbia and Vancouver Coastal Health. In our lab, we are exploring the intersection of AI with histopathology images and genome information to discover invaluable insights in both clinical and biological research. So, about the ovarian cancer. Ovarian cancer is the most lethal cancer of the female reproductive system. Currently, the conventional diagnostic approach for this type of cancer is based on microscopic examination of the hematoxylin and ESN images. But here is what makes ovarian cancer complex. Ovarian cancer is not a single disease, but it's several diseases. For 5 primary subtypes have been identified for this type of cancer, including HGSC, CCOC, ENOC, LGSC, and MC. Additionally, there are several rare subtypes as well as normal cases among data. These subtypes have distinct characteristics, like they have their own unique cellular morphologies, diverse molecular and genetic profiles, and different clinical outcomes. Treatment options for ovarian cancer encompass several approaches, including surgery, various forms of chemotherapy, and hormone therapy. The choice of this treatment is highly dependent on the subtype of cancer. This underscores the significance of accurate subtype classification of ovarian cancer. But we have challenges. We need a specialized expert. Currently, ovarian cancer diagnosis relies on gynepathologist with the Cohen kappa of 0.89, indicating a high level of agreement. Cohen kappa is a metric for measuring the agreement of pathologists, with 1 indicating perfect agreement and 0 means like chance agreement. But gynepathologists are rare, and the general pathologists are more available in community hospitals. Unfortunately, the Cohen kappa of general pathologists is from 0.54 to 0.67, which means the agreement is very low. The problem is that the underserved communities have lack of access to gynepathologists, and even the well-developed communities encounter a shortage of expert pathologists. In response to this concern, we introduced the OCEAN Challenge, an AI-based competition that focuses on the task of ovarian cancer subtype classification and outlier detection. OCEAN launched on October 6th with a 3-month duration, concluding on January 3rd, and the winners of the competition will be rewarded with decent prizes. So this is a general overview of the OCEAN. Within the OCEAN, we work with 3 distinct data sets: training, validation or public test sets, and private test sets. These samples are sourced from diverse centers, resulting in variations in color across datasets. OCEAN focuses on both tasks of classification and outlier detection. In the classification aspect, OCEAN involves the five common histotypes in both training and testing datasets. While for the outlier detection aspects, only the test sets include rare subtypes and normal cases. So let me highlight the importance of incorporating outlier detection. In clinical practice, we would like to rely on AI as a tool to support pathologists. We apply AI to H&E slides and present the outcomes to pathologists, who then review the slides with the guidance of AI. But without the inclusion of outlier detection, pathologists face an additional task of reviewing the slides before implementing AI to separate the outliers from the rest of five common histotypes. The extra step is necessary since the AI module's primary function is only for classification. Therefore, the incorporation of outlier detection reduces the workload of pathologists and guarantees the coverage of all cases. For further insights on outlier detection in histopathology, you can explore relevant research papers like the one mentioned here. The OCEAN dataset is the most extensive and diverse dataset of histopathology. Images of ovarian cancer from more than 20 centers across 4 continents. Within the training set, we have about 500 samples from 11 centers with one of the common histotypes. In the public test sets or the validation, we have around 500 samples from 13 centers, including both 5 common histotypes and outlier, and the private test sets consist of 1,500 samples from 22 centers. There is a fundamental challenge for processing large gigapixel images for your deep learning model. The problem is that the slides are too large. It's impractical to use any slide as an input to your deep model. To overcome this problem, it's essential to work with patches, tiny, manageable portions of the image. Here are some strategies for patch extraction. You can have comprehensive patch coverage, which means extracting all of the patches within one slide. You can have random sampling, which means extract a fixed number of randomly patches from the slide. And you can have focus annotation, guided patches by leveraging pathologist annotation to extract patches from the area of interest. We are providing the pathologist annotation for a subset of about 150 training slides. These annotations are structured as text files, detail the location of key areas, including tumor necrosis and stroma with the respective coordinates, like the samples mentioned here. And it's worth noting that these annotations are based on slides with 40x magnification, while the provided slides here for the OCEAN are at 20x magnification level. Therefore, an initial step for you involves scaling this annotation to align with the dataset. Moreover, to further advance your method, you may consider developing an auto-annotation model. This model would be designed to efficiently identify whether a given patch is tumor or non-tumor, enabling the automated annotation of the remaining cases. So, PANDA success story. The closest competition to ours is the PANDA for the prostate cancer grade assessment. This event attracted over 1,000 participants, which was a great landmark in histopathology. The findings, including the top performing methods of the participants, have been published in Nature Medicine journal. What distinguishes OCEAN from PANDA? First of all, we have outlier detection. Moreover, OCEAN dataset is more diverse by including samples from more than 20 centers. And additionally, OCEAN dataset includes hysterectomy samples, while PANDA focused on biopsies. Since the hysterectomy images encompass significantly more tissue information, most probably OCEAN datasets includes a larger volume of tissue data. Why your participation matters. Accurate ovarian cancer classification enables right and personalized treatment for right patient, which has a direct impact on patient outcome, leading to an enhanced quality of life for patients. Your participation contributes to better patient care worldwide, making a difference regardless of where patients are. So, we extend a warm invitation to histopathologists, researchers, data enthusiasts, and all those passionate about advancing cancer research. During less than a month, OCEAN has welcomed about 350 teams, and the current highest performance stands out 52% of balance accuracy, yet there is still plenty of room for the improvement. Moreover, our discussion chat is monitored daily, and we are eager to assist with any concerns or questions you may have regarding the competition. So please don't hesitate to reach out to us. We are here to help. At the end, I would like to thank all members of AIM Lab for their support, the pathology team for their invaluable assistance in reviewing all of the samples within the dataset, and the Kaggle team for providing the platform for the participants. Thank you very much, and good luck with the competition.